Hello, and welcome to the 2021 in online employee benefits meeting for Autism Learning Partners for Central and Northern California. In this online meeting, I am going to go over as much as I can and give you a refresher of the benefits and some of the things that are new for 2021. So hang in there with me as we go through this tour. If you do need help enrolling in the benefits after we get done with this meeting, there will be a separate video if you have forgotten or need a refresher course to actually get online and make some of your benefit selections. Because of course, everything is done electronically. We do not do paper or any of those types of things. We try to save some trees around here. So without further ado, let's scroll and get into some of this. Um, you may have seen what we're looking at on the screen right now. This is the benefits guide. I am using that as our template so that we can follow along, and also so that you could go back and look at the benefits guide later and find some of the information. However, the benefits guide is really more of an overview, and the rest of the benefit summaries are actually in the portal. So the full benefit summaries will be there for you if you need them. And if for some reason the question you have is not answered either by this meeting or by those benefit summaries, feel free to reach out to us. I will give you our contact information in a few minutes. For 2021, it's important that you note, just like in your benefits guide, that under the HSA, which is the health savings account, for 2021, the contribution limit is increased to $3,600 for individuals and $7,200 for an employee, independent, or family. Under the United Healthcare PPO dental plan, I'm going to go over later today that there is a rollover benefit. This is really cool. I will go over what that means for you, just so you know, once again, what's new in 2021. Now, once again, just to restate, all of the changes that you're going to be made are going to be made online. So you really do have to log in. You do have to confirm what your selections are going to be for the next year. Look at your payroll deductions, because once we get past the open enrollment period, we will not be able to make any changes. So it's super important that if you're thinking about going up the ladder for a particular plan or going down the ladder, that you do all of that at this time. Because even later on, if you have what is called a qualifying life event, which is the only other time that you can add or take a dependent off of your plan, you still cannot change your plan benefit level. So you cannot change the benefits that you have. You're really only adding or taking somebody, off of the plan. Usually a common life event is going to be marriage or birth of a child or loss of other coverage. So those are typically how those are looked at, but none of those change your actual benefit level. So as we're about to get into this, let me just give you our telephone number in case you already have some questions that you're going to reach out to us, and you want to find out what those answers are. Our telephone number is 818-883-3282. Chuck Best is at extension 105 and pound, but my name is Jonathan Rudnick. I'm the one doing this meeting. The number is still the same, except for my extension is 1760 pound. Charles M. Best, his email address is listed here in your benefits guide. If you need to get a hold of me, my email address is J like Jonathan, R-U-D as in David, N as in Nancy, I-C-K, at lafinservices.com. There are some other brokers in the office, so if you're just going to leave us a general message or something like that, you may get one of the actual voicemails for them. But if you need to get to us specifically, please put in those extension numbers. That will take us directly. That will take you directly to us. If you do have a qualifying life event, right, please try to notify us as soon as possible. Here we have listed in the benefit guide to contact us within 30 days, and there is a reason for that. The sooner that we hear from you when something is going on, the quicker that we can get that remedied. If we do need to add on a dependent, the sooner that they will get into the system. So if you wait too long, you could be locked out from having that dependent added on, and you definitely don't want to do that. I'm sure that if it's a newborn or a spouse who has lost coverage somewhere else, you want to do that as quick as possible. So the best way to do that is get to us as quick as possible. Quick thing that I want to mention before we get into some of the medical benefits under the HSA, which is the health savings account, right? That has to be coupled with the medical plan, right? So you cannot contribute to an HSA unless you have a high deductible health plan that is HSA compatible. So if you do, and we do have one in the plan portfolio this year as well, right? The first $200 that gets deposited into your individual HSA account will be reimbursed by your employer. Now, if you have more than one person on that, right, yourself and a dependent, they will go as much as $400, right, to reimburse you. So those are cool things to note for this year. Just keep those in perspective as you're trying to make some of your choices. So let's look at some of your plan options for this year. You have quite a few different medical options. On the first page here, we have the two different PPO options that you have at your disposal. PPOs allow you to go in and out of network. They are very different than some of the other plans you may have encountered in your lifetime. But the good thing to know is that you definitely can go in or out of network. You do not sign up with a primary care doctor. This is one of those things where you choose the doctor that you want to go see, and you ask them if they're in network or check in the provider directory, and then that's kind of how you set up your care. So you're definitely managing it more on your own, and there is more freedom. We have two options with United Healthcare. It is the traditional PPO, and we have the HSA. They both use the same provider network, so there is no difference in the providers, but there is a big difference in the way that the plans work. Under the IRS guidelines, an HSA plan or high deductible health plan that's HSA compatible has to meet a certain guideline in order for it to even be considered an HSA. And the way that that works is that they do not offer first dollar benefits on those types of plans. That's one of the rules that has to happen. So most of the time you would have seen really large deductibles under an HSA. However, your employers negotiated a much lower deductible on some of these plans. And the good thing about that is it makes it easier for you to choose between having a traditional PPO or an HSA this year and in the last few years. But what you are going to notice when we go over the HSA is most of the things are going to be subject to the deductible other than preventative care. All right, so let's get into this and see what's going on. So under the traditional PPO, you can see that the deductible for individuals is $1,000. For individuals under the HSA, it is actually $2,000, right? The out-of-pocket maximum under the traditional PPO is $5,000, and under the HSA, it is $4,000. Okay? Now here's where we're really going to start seeing the unique differences between the two different plans. Under the traditional PPO, you can go to the doctor as many times as you want in a year for $35. However, under the HSA, right, you really aren't getting one of those co-pays or anything like that until after you've met the deductible. After you've met the deductible, it is 20%. So keep that in perspective. What is happening before you hit the deductible? What is it going to cost to go to the doctor? Well, that really depends on what the doctor charges per visit. You know, you're still getting the benefit of United Healthcare's negotiated rate, but to go see a primary care doctor could be $75, right? And the range for seeing a specialist could be $100, $200, $300. You don't really know until you receive the EOB exactly what that particular doctor is going to charge you, but normally they will let you know when you're getting prepared to come in for one of the visits based on the type of plan. Now, of course, you probably have money in your HSA account, money that you may have built up over the last few years, or money that you may want to put in to obviously meet some of these expenses throughout the year. That's the way that you would want to run the HSA plan. Under diagnostic lab and x-rays, it is a $0 copay and there is no deductible, so you can get those services for free. Under the HSA, remember, 20% after the deductible. As we go down the list, you're going to see it with the HSA is going to look very familiar over and over again. All right. Before I get into the prescription drugs, I do want to mention that when we're talking about preventative care is one of those items that is available under each plan, and that starts right away. All right. You can get annual physicals covered at 100% under either plan. So even though the HSA doesn't have first dollar benefits, for a lot of things, preventative care is still covered at 100%. So when you are younger, usually you just get the annual physical. When you get to be about 40, they are going to start offering you a mammogram if you're a woman or a PSA test if you're a man. And when you get to 50, a good example is a colonoscopy. All right, so those are available on both plans and they are 100% covered. You do, for the most part, have to go to an in-network doctor. When you start going to out-of-network doctors for preventative care, definitely gets tricky, and you'll have to look at the benefit summary because most of the time that is not covered that way. When you're looking at the prescription drug benefit, here's another nuance of having the HSA plan. You can see here that it's combined with the medical deductible, which means that you have to meet the medical deductible before you get the prescriptions for the copays listed down below. So huge, super important point there, right? However, under the traditional PPO, you can see that there is no pharmacy deductible, and you can get tier 1, tier 2, or tier 3 prescriptions for our copay. When we are looking down below at inpatient hospital services or outpatient surgery, right, it is a $100 copay plus 20% under the traditional PPO and just a straight 20% under the HSA. Now, outpatient surgeries, this is where a lot of elective surgeries will happen and services will happen, right? And so you have to be aware of how that's going to work on your plan. Because if you're going in for a knee surgery or a shoulder surgery or a foot surgery, right, this is going to be 20% after the deductible on the traditional or 20% after the deductible on the HSA. These amounts, right, are not going to go on forever. One of the things that I'd like to remind everybody about is that because you have out-of-pockets on these plans, that out-of-pocket limit is basically making sure that there is a stop loss, an end to where you have to pay into the plan. Once you hit the out-of-pocket, especially for an individual, you're at 100% care for the rest of the year in network. If you go out of network, you can see that those numbers are different, and it works different, right? Because when you go to an out-of-network provider, there is no contract with that provider. So you have to be very careful that if you do choose to use out-of-network providers, that you definitely, there is going to be more cost involved. Looking at the emergency room under the way that this is set up here, it's a $100 copay plus 20% under the traditional PPO and 20% after the deductible under the HSA. Now, urgent care, right, is a $35 copay, so you can go as many times as you want under the traditional PPO for $35, or 20% after the deductible under the HSA. So those are super huge. I think that if you need to get a prescription, on the weekend, you can't get a hold of your doctor, right? These are the types of things that you might be able to get done at the urgent care and save yourself a trip to the emergency room. When you go to the emergency room, it is much more expensive than going anywhere else. And, if you can somehow keep that cost down, it's good to see if you can get some of that done at the urgent care. Now, if you are in an ambulance, they are taking you to the emergency room. But some of the times, like for a sinus infection or some of these other things, you can definitely get that handled at the urgent care and save yourself some time and money. And there probably will be a shorter wait at the urgent care than anywhere else. So use the urgent care, figure out which urgent cares are in network. That will be a great way to save money in 2021. So that brings us on to the next two plans that we have here. You have two different HMOs, one with a $1,500 deductible and one with no deductible. Now, obviously, this is for the benefits for 2021. So no matter what it is that you have today, you can go to one of the four plans that we have listed here. So this is really your opportunity, I can't say it enough, to kind of plan out what you're going to do. Whether you're pregnant, whether you're planning to have this surgery, keep all of those things in your mind because you may think that you're paying more to have one of these plans, but at the end of the day, once you start calculating how much it is for your surgery and all these different things that you might have to do to get the surgery, it may work out to be better to be on the higher level plan than you ever thought of before. So under the $1,500 deductible plan, of course, there is a $1,500 deductible for individual, $3,000 per family, and there is a $0 deductible under the $0 deductible plan, okay? Out of pocket for an individual is $5,000 under the 1,500 plan and $3,000 under the $0 deductible plan. So $2,000 of difference there. That may be meaningful to some of you depending on what it is that you're going to have done in this year. So let's explore how that's going to work for this year. Under the $1,500 plan, right, it is $25 to go see the primary care doctor and $40 to see the specialist. Under the $0 deductible plan, it is $30 to see the PCP and $40 to see the specialist. Remember, anytime that you go under the HMO, right, you have to pick a primary care doctor and go to that doctor for all your care. Now, most of the time that doctor is at a medical group, and that is where all of your specialists and your hospitals are going to be. So make sure you know exactly what you're going to do. Now, this isn't the time to actually change your doctor. You can actually do that all year long, but this is a good time to figure out what type of plan you're going to take for this next year. So as we're going through, right, you can see that there are different copays for diagnostic lab and x-rays, right, under the $1,500 deductible plan and the $0 copay under the $0 deductible plan. Imaging is the same under both plans. It is both a $100 copay. If you're thinking about getting surgery on your shoulder, they most certainly will do an MRI if you're in pain for that. And being able to get it for $100 is a huge savings proposition because typically the MRIs are in the $1,000 or more range. Prescription drugs. Under both plans, the prescription drugs are exactly the same cost, and there is no pharmacy deductible under either one. Okay, so that means you're going to get your drugs for minute one, and they're both going to cost you the same under either plan, $15, $35, or $70 for tier 3 prescriptions. So what about hospitalization? So here's where maybe your major choice is going to be made this year. It is 30% copay after the deductible for both inpatient and outpatient surgery under the $1,500 deductible plan, and it is a $500 copay per day under the $0 deductible plan with a 3-day max copay when you're in the hospital. So that means if you're delivering a baby, maybe if it's a normal delivery, you're in for 2 days, so that's $1,000. But if you get a C-section, you're there for 3 or 4 days. They're letting you know if you hit the 4th day, you max out at $1,500, so you don't have to pay for that extra day in the hospital. So that's good news. That may be one of the reasons why you go on this plan this year. When we're talking about outpatient surgery on the $0 deductible plan, it is just 20%. Now you can see that the deductible is not involved, right? Obviously, so it is just 20% for minute one. Now, when we are talking about emergency services, right, emergency services are $150 copay under the $1,500 deductible plan and a $200 copay under the $0 deductible plan. Urgent care is $25 under the $1,500 deductible plan and a $30 copay under the $0 deductible plan. So once again, double check where your urgent care center is. That's one of those things that can help you save money. I truly believe, why spend more money than you have to? We've already been through enough, this past year. So some people have been trying to save money just because of the way things have been going on. So that would be my advice for 2021 as well. So how do we go about finding a provider? Well, that's very easy. I do believe that UHC has a good provider finder. You go to myuhc.com. You don't necessarily have to log in. You can shop around, but you do have to know what network you're shopping in, and that's super important if you're going to get the right providers. You need to choose the signature value HMO if you're going on the HMO plan, or you're going to use Select Plus to select providers under the 2 different PPO options. Remember, I said they use the same provider network, so super important that you make sure you select the right things. It would be not fun to wake up one morning and find out your provider is not who you chose it to be. So, if you need to search for a dental provider or an HMO dental provider or a vision provider, right, these are some quick links to help get you there. We haven't talked about the dental yet. We are going to talk about that next, so you can snap back over here if you need to find out where those providers are. Once again, I think that it's pretty easy to find providers in UHC, but reach out to us if you do get confused. So you have 2 PPO options. I know that it looks like there are 3, but there are only 2. There are United Healthcare HMO dental plan and the United Healthcare PPO dental plan. It just so happens that the PPO has in and out of network benefits, so that's why it looks like there is an additional plan there. All right, as we go down the list, right? Let's talk about some of the differences here. Under the HMO dental plan, it is kind of like HMO medical. You do pick a primary care provider and go to that dentist for all of your care. There are less dentists in the HMO network than there are PPO dentists, so keep that in mind. Probably about a third. So when you're looking for providers, I would just say try and find the provider that you want to go see, and maybe you can locate them in one plan or the other so that you will be happy for this next year. But there is no penalty for moving to the HMO to the PPO or the PPO to the HMO. You can definitely do that at open enrollment. Remember that if you didn't put your dependents under the medical plan, but you do want to include them in the dental plan, not a problem at all. That is exactly what you can do with the way that the plans are set up here. So a couple things to note. The HMO dental plan works off of a copay schedule. You do have that copay schedule inside your portal. That is all the codes that are listed for the entire plan. So if you do not see a code on there where you go get a dental service, that could mean that it's not covered or that the dentist is recommending something that is not covered by the plan. So anytime you have more than about $300, $350 worth of work, I would definitely ask the dentist for a treatment plan, and they can match up all the codes for you and you can find out what is what and make sure that you don't end up with a $5,000 bill when you thought it was going to be $500. Now, there is no deductible under the HMO plan. It has no benefit max. You can definitely get 7 crowns if you need to, as long as you pay the copay under the plan. You do get preventative care under the HMO dental plan. That's going to give you 2 cleanings a year. It usually gives you a basic oral exam and basic x-rays. So that's all covered at 100%. All right, but let's contrast that with the PPO. Under the PPO, right, unlike the HMO, which you are restricted to in-network providers, under the PPO, you can go in or out of network. Just remember that just like a PPO medical plan, if you do choose to go to out-of-network providers, that is going to cost you more money. And if you can go to a network provider, they have a contract with that provider, that will definitely save you money. Now, there is a deductible under the PPO, and the PPO does not work off of a copay schedule. It actually works off of percentages. So the $50 one time a year deductible is going to apply to basic and major services. It is not going to apply to your annual preventative care. So you get your 2 cleanings a year, once again, covered at 100% in network, and your oral exam and some basic x-rays. So all of those things are going to be covered at 100%. Now, basic services and major services are going to be covered differently. Basic services, which include fillings and root canals, are going to be covered at 20%, meaning you pay 20% of the bill, and the insurance company is going to cover 80% of the bill. But that's after first meeting the $50 deductible one time in the year. Major services are going to be covered at 50%. So if we're talking about bridges, dentures, and crowns, those are all going to be major services. So you're going to pay 50% of the bill, and the insurance company is going to pay the other 50%. So what if you need orthodontic care? You can get child orthodontia under the HMO, but it is not available under the PPO. And basically, this is the lowest copay I have ever seen for child ortho, ever. A $1,000 copay. So if your child needs orthodontic care, this might be a place to start because the copay is lower than what I've seen anywhere else. If an adult needs orthodontic care, the copay is $1,895. All right. Now, under the PPO, I was talking to you earlier, and I said there was something new. And in regards to rollover, many people ask me every year, hey, my plan has this annual benefit max. I only got 2 cleanings. Is this dental really worth it? I don't feel like it is. Should I get it? Should I not get it? Well, now, as an incentive, if you just get your 2 cleanings a year and maybe your oral exam, and you're thinking, well, the last couple of years have been okay, if you stay below the threshold of $1,000, right, they will contribute up to $600 into a special account for you, and then you can use that with next year's benefit. So if that turns out to be a really bad year in the following year, you might have this extra money here to get the extra crowns or the extra root canals you need to make sure that you're no longer in pain or that you can save your teeth. So how about vision? Time to talk about vision. I think vision is a really important benefit this year. We've all been working from home, been on our computers probably more than we thought we would be. Because of that, I think it's even more important to get your vision checked, especially in 2021. If you weren't in the vision plan, no problem. You can definitely get into it this year. The way the vision plan is going to work, and just as a refresher, you can get the exam every year, every 12 months, as it says here. You can get lenses every 12 months, and you can get frames once every 24 months. So that is the frequency in which you can get all these benefits. The exam is going to cost you $10, but let's say that that exam is really $75. You're only going to pay the first 10, and the insurance company is going to pay the rest. For materials, so for like single vision, bifocal, or trifocal lenses, you're going to pay the first $25, and then they're going to cover the rest. But this isn't going to account for transition lenses or scratch resistance. Most of those things are extra, so just keep that in mind when you're trying to figure out what the insurance company is actually paying for. Because you've paid the $25 for materials, they are also going to give you up to $130 to spend on frames, and just remember that's once every 24 months. Now, this is a PPO vision plan, so you can go out of network, but just remember they're not going to cover as much when you go out of network, and so, right, your benefit may not go as far. But normally, I would tell people to evaluate this based on premium, even if you were just going to get the eye exam, right? A lot of people think they're going to get the eye exam as part of the annual physical. But doctors will basically test you to see if you can see, but they are not giving you a prescription or do anything else like that. So this is the one way to actually get the prescription for your lenses. Now, normally these benefit plans can cost $15, $20 for vision. Your premium is so low under this plan that I don't know how you can ignore going on the vision plan. I think everybody should enroll in this, just for the simple fact that you're probably going to need to get one eye exam throughout the year, and it will essentially pay for itself. So this is a really tremendous deal here. There's a little bit of a refresher of the HSA amounts that we talked about earlier. Remember, the HSA is not the FSA. And lo and behold, what is next? The dependent care FSA. FSA is flexible spending account, so it is not health savings account. It works entirely different, and it is for something entirely different. The FSA uses that familiar quote that everybody's used to: use it or lose it. The money that you put into the FSA, which is up to an amount of $5,000, needs to be used by the end of the year, but they do give you a little bit of leeway and say that you have to submit receipts by March 15th, 2022, otherwise you will lose that money. So there's a little bit of a way to sneak in the last receipts there if you miss, the end of the year. But you definitely have to do it before then, or you will lose the rest of that money. Now, what can this be used for? The FSA can be used to be reimbursed for day or custodial care expenses for dependent children that are considered your federal tax dependents under the age of 13, and for a disabled adult federal tax dependent that lives with you so that you or your spouse can work or attend school. Now, because this is a commitment that you're making for the whole year, it actually gets the amount that you're going to put in gets divided up equally per paycheck, right? And it's a little bit different than the HSA. The HSA doesn't necessarily require you to put in the exact same amount in your HSA account through payroll. It's easier to do things in equal increments under the HSA, but the FSA is very different because it is requiring you to do things equally through your paycheck. So if you have any confusion about that, definitely reach out to us. We can definitely answer questions as we move forward on that. So your company provides you with a basic life and AD&D benefit. This is at no cost to you, so you definitely should see yourself enrolled when you go into the portal. Just want to remind you that it's a good time to make sure your beneficiary is the correct one if you've gotten remarried, or if you've just gotten married, or maybe one of your children got to be 18 and now you want to make them the beneficiary. This is a good time to review all of that and make updates. Obviously, this was a very difficult year. It would not be fun if something happened to you and the life insurance went to the wrong person. Your life insurance benefit for you is one-time salary. Moving down the line, if that's not enough life insurance, you can purchase additional life insurance. Obviously, in this year, once again, I can tell you that people have been asking me left and right about life insurance and getting additional life insurance. If you find yourself in a position where you said, oh, maybe my friend or my brother or a relative might be able to sell you some additional life insurance, my question would be, If you haven't done it yet, here's what I would say. I would definitely buy the life insurance through the portal, because at least you can get this and it will be done right away. Okay. However, right, when it comes to the next year, if you've actually put this plan in place with whoever that relative is or that person that you know, then you can come back and you take down some of this life insurance or get rid of this voluntary life if you don't need it anymore. But the biggest mistake that I see made is letting this go, right, and not having what you need from day one, because this is the easiest way to get it. Funeral cost, and I've been to quite a few in 2020. Unfortunately, right, even the basic kind of funeral is probably about $15,000, and that's with nothing extravagant. So they definitely can be more expensive than what most people are anticipating. But you also have to think about maybe a mortgage, car payments, college educations, all these different things that might have to be paid for if you are no longer alive. So I know we don't like to think about those things, but it's good to think about that while we're going through open enrollment and participate in the plans that you see fit. This is your one opportunity to do that. A couple of other plans that we will talk about in the next couple minutes are the disability plans. There are short-term disability and long-term disability. Short-term disability kicks in after 7 days, right? And what it is really designed to do is get you up to more of your weekly covered earnings. When you get state disability, which everybody thinks is a great thing, it just really doesn't pay you enough. So you definitely need another plan that is going to get you closer to the 70%. That is what the short-term disability is there for. However, that only lasts, right, for 12 weeks, right? So that brings us to the long-term disability. And the long-term disability and short-term disability products are one of those things that are hard to get on your own, especially for long-term disability. This is one of those things that in a group setting can be completely affordable. And to be honest with you, it's normally called paycheck protection. If something happened to you, how would you pay your bills? You're still alive, remember, you didn't die. So in this scenario, you may not be able to work for a few years, not just for a few months. If that does happen, this plan is going to pay 60% of your monthly earnings, right? And what happens is it kicks in after the elimination period of 90 days, it kicks in on the 91st day. All right, so the one thing about that that's important is that in addition to that, this has the ability to run up to Social Security normal retirement age. So that's super important. You know that it's there to protect you as we get older, right? Some of the younger people today realize that we probably won't retire until we're 70 years old, maybe even longer. So this benefit could help you pay the mortgage and some of those other things when you really can't work. So take a look at it. It may be something worth investing into yourself for this year. So the last three plans that I'm going to talk about are hospital indemnity, accident, and critical illness. All of these plans obviously are all voluntary. They're not things that you have to enroll in, but they are things that everybody is thinking about for this particular year and going into 2021. The hospital indemnity plan is a plan that pays you, and depending on the benefit that you pick, 1,000, 1,500, or 2,000, it does exactly that. You end up in the hospital, it's going to pay you that 1,000, 1,500, or $2,000 benefit. That's money that gets paid directly to you. So it does not go to the insurance carrier. So whatever happened because you were in the hospital, it's not going to the insurance company. It's coming direct to you to help you in your time of need. Now, the accident plan is going to pay you if you have an accident. So you may be at home washing dishes in the sink, you break a glass, it cuts you, you have to go to the emergency room. They're going to pay you amounts depending on what's happened to you. Now, the full list, because there's more than what's here, is inside the portal. But just to give you an example, if you end up in the emergency room, they're going to pay you between $100 to $200, right? Let's say, for example, right, that they have to do some testing while they're there. They're going to pay you between $160 to $320. So this is one of those things that can really help you out if for whatever reason you do have an accident. And a lot of times these things happen at home. So don't be afraid. If you have the accident plan, this will just give you additional protection. The other thing that's cool about the accident plan is it's going to pay you if you've done some of the wellness that's listed on the plan. And basically, if you let them know that you've done some of this wellness, they are going to send you some money, up to about $200 per year for an employee and spouse. So double check that. That is a very cool benefit. And by the way, it pretty much is just paying for itself. So you're going to get some money no matter what's going on this plan, even if you don't have an accident. The critical illness plan, once again, this is one of those benefits that's become more important in the last year. You can choose a benefit of 5,000, 10,000, or 20,000. If any of these things below happens to you, this is money that's going to be paid to you. So for example, if you have a heart attack, an invasive cancer, renal failure, right, they're going to pay you 100%, right, of that benefit. So that 5 or 10,000 or $20,000 in that time of need, once again, is going to get paid directly to you. And if you need to use that for your mortgage payment or something else, definitely, this is the type of thing that you want to use it for. So a lot of people have been asking about these types of benefits because of the way that 2020 went. I don't know what 2021 is going to provide us with, but it's just good to enroll in the plans that you believe in. The last and final thing that I want to talk to you about is the employee assistance plan. This is not a plan that you pay for. This is a plan that your employer is providing. Once you call this telephone number here, they can talk to you in confidentiality, right, about things like stress, anxiety, depression. Maybe you have an issue with a relationship or a parenting question. These are all things that they are going to provide to you. Now, they are going to give you a few counseling sessions with a local therapist for free, and then they will also let you know or where the referrals are to go on and continue some of your treatment, depending on what it is that you need. So this is a great benefit. It's something where if you don't feel like you want to go to HR about it, that you still be able to talk to somebody and have it be in private. Well, here we are, folks. We made it to the end of the meeting. You survived. It's great. Hopefully you're still awake. If you need to get a hold of us, I'm just going to repeat these numbers one more time. It is 818-883-3282. The email address for Chuck Best is right here, charlesnbest@lafinservices.com. My email address is J like Jonathan, RUD, N as in Nancy, ICK, @lafinservices.com. Once again, we are here to help you. There are a few other brokers in the office just in case you have questions. But please reach out to us. Once again, you will do all of this stuff in your online portal. There will be a separate video to give you a refresher course on that. But other than that, have a great day or evening, and feel free to contact us if you have any questions. We'd love to hear from you. Thanks.